Is your dog feeling under the weather? A little bit depressed, vomiting, or having diarrhea? Poor Fluffy. You just want to take him out for walks again. You might be wondering, what do I do? Well, look no further, for I, John Veterinarian, will provide you with all the answers. What your puppy might be dealing with is a case of leptospirosis caused by the bacterium Leptospira interrogans. This squiggly dude is the most common Leptospira species in a dog. Among its 250 serovars, the two most clinically relevant ones in Australia are Serovar copenhageni, predominant in Sydney and coastal New South Wales, and Australis, which is mostly in northern Australia. This spiral-shaped gram-negative bacteria has four main components: its peptidoglycan layer, flagella motor, two periplasmic flagella which allows for motility, and an outer membrane loaded with pathogenic proteins. Now let's get back to Fluffy. Where do we reckon he might have gotten lepto from? The main reservoir hosts in Australia are feral pigs and rodents. And rodents, well, they tend to roam around and pee in a lot of places, like recreational parks, national parks, or even urban areas. Leptospira is transmitted through all body fluids, but most commonly through urine. And when Fluffy goes around sniffing and putting his nose into contaminated soil and surfaces, or takes a drink out of questionable water, it's free real estate for the bacteria. Leptospira is typically associated with areas of high rainfall and can survive for up to 4 weeks in certain environments. As it turns out, humans and dogs are both victims of the pathogen. In particular, if the dog, or the human, is immunocompromised or likes to roam, then it makes it all the more likely for them to be infected. Remember when Fluffy put his nose in contaminated soil? What happens after that? Leptospira then enters Fluffy's body through mucous membranes or broken skin, and uses its surface-associated proteins and adhesins to first stick, then penetrate the skin barrier, gaining access to the bloodstream. After incubating for about 7 days, non-specific clinical signs such as pyrexia and edema appear. By day 14, the leptospires would have invaded various organs such as the liver, kidneys, lungs, genital tract, and CNS to replicate. As it replicates, Leptospira destroys host cells as its surface proteins are hemolytic, cytotoxic, and lipotoxic. This can cause acute kidney injury, jaundice, or pulmonary hemorrhage, although acute kidney injury is most common. Fluffy might start displaying signs of vomiting, diarrhea, PUPD, weight loss, and abdominal pain. Some hematology and biochemistry findings related to lepto will be in the form of increased ALP, ALT, hyperbilirubinemia, anemia, and azotemia, although specific diagnosis tools will be required to confirm. There are 3 ways we can detect lepto: the microscopic agglutination test, MAT, the SNAP lepto test, or a qPCR. The MAT is the gold standard as it is serovar specific, despite it taking longer in contrast to the SNAP test. However, recent vaccinations may lead to false positives in these tests, with the exception of the qPCR. In reality, you'll probably be doing more SNAP tests in the practice more than anything because it's quick and easy. When a test turns up as positive and the clinical pathology or signs correlate, we can then confidently diagnose Fluffy with lepto. Fear not, as bad as lepto sounds, treatment is easy. This includes only 2 weeks of antibiotic treatment such as doxycycline or penicillin with simultaneous supportive care. Always vaccinate your dogs. The commercial C7 vaccination includes leptospirosis protection and can help reduce the risk of severe illnesses, but by far the best way is to keep Fluffy away from places that may be contaminated with infected urine. When your dogs are unwell, do not hesitate to call me, John Veterinarian.